Hey everyone, welcome back to our channel. Drawing blood might sound scary, but today I'm going to show you how to do it without pain. Whether you're a healthcare professional or just curious, this guide will help you understand the process better. Let's break it down into simple steps so you can feel confident and comfortable. Remember, a calm and methodical approach is key. First things first, let's talk about preparation. Proper preparation can make a world of difference. Make sure you have everything you need: alcohol swabs, a tourniquet, sterile gloves, a needle, and collection tubes. Having all your supplies within reach will streamline the process. Wash your hands thoroughly to keep things clean and avoid infection. This step is non-negotiable. Now, find a comfortable spot for the person from whom you're drawing blood. Comfort is crucial for both the patient and the person drawing blood. It's best if they can sit or lie down in a relaxed position. This helps in reducing anxiety and makes the veins more accessible. If they're tense, the process might be more painful. Encourage them to take deep breaths and relax. Next, put on your gloves and apply the tourniquet about 3 to 4 inches above the elbow. This helps in making the veins more prominent. Ask the person to clench their fist to make the veins more prominent. This simple action can make a big difference. Take your time to find the right vein. Rushing this step can lead to complications. The median cubital vein is usually the best choice because it's large and close to the surface. However, always assess each patient individually. Once you've found the vein, clean the area with an alcohol swab. This step is essential for maintaining sterility. Use circular motions and let it dry completely. This ensures that the area is properly disinfected. This step is crucial for preventing infection. Never skip or rush through it. Now here comes the part that might make you nervous: inserting the needle. Stay calm and focused. Hold the needle at a 15 to 30 degree angle with the bevel facing up. This angle helps in smooth insertion. Take a deep breath and insert the needle smoothly and steadily. Confidence and steadiness are key here. Don't rush. Slow and steady wins the race. A smooth insertion minimizes discomfort. When you see blood flash back in the hub of the needle, you've hit the vein. This is a good sign that you're in the right spot. Attach the collection tube and watch the blood flow. Ensure the tube is securely attached. Keep an eye on the patient. Check if they're comfortable and not feeling any dizziness or discomfort. Patient safety is paramount. Once you've collected enough blood, release the tourniquet before removing the needle. This step helps in reducing pressure and pain. This helps minimize pain and bruising. A gentle approach is always best. Take out the needle gently and immediately press a clean gauze pad on the puncture site. Quick action here can prevent excessive bleeding. Ask the person to apply gentle pressure to stop the bleeding. This helps in forming a clot and stopping the blood flow. Finally, dispose of the needle safely in a sharps container and label the blood samples correctly. Proper disposal is crucial for safety. Don't forget to remove your gloves and wash your hands again. Hygiene is always important. And there you have it, a step-by-step guide to a painless blood draw. Drawing blood doesn't have to be painful or stressful. With the right technique, it can be a smooth process. Just follow these steps, stay calm, and you'll do great. Confidence and practice are your best tools. Remember, practice makes perfect, so don't get discouraged if it takes a few tries to get it right. Thanks for watching. If this video was helpful, give it a thumbs up, and don't forget to subscribe for more easy tips and tricks. Your support helps us create more valuable content. Stay healthy and see you next time. Take care and happy learning.